Good afternoon, my name is Ross and I'm on the Epic implementation team. And today we're going to be following the story of a patient, Richard Hawkins, who's a 20-year-old male. He has a history of seizures and he actually fell down and fractured his leg. And what's going to happen is Richard is going to be rushed to the ED, transferred throughout the OR, and then moved back to the floor where he's going to have medications that are tracked, delivered, and administered, all using different standards of interoperability here between our vendors. And so within Epic, our patient is currently within the ED. We currently have a GE image viewer embedded within Epic, whereas the physician, I'm able to get a real-time glance at my patient's leg fracture. And because it looks pretty bad, I'm going to order surgery immediately for my patient. We actually pre-registered our patient for surgery earlier, and during that time, we tagged the patient with an RTLS tag. I'm going to hand it over to Bob from Stanley, who's going to talk about how the patient is going to move throughout the OR and how we're going to track his movement.
Hi, my name is Bob Metzler with Stanley Healthcare. Once the patient is registered in Epic and assigned a tag, the patient is automatically created in our system with a tagging message. So Epic is going to pass the patient and the tag plus demographics information to us, and we're going to pass location back to Epic. So the nurse can either see location here in mobile view, or they can see location back in Epic. We're going to start Richard on his journey through the OR and see how he moves and explain a little bit about what's going on. So he's going to get going pretty fast, and he's going to first, you should see an update. So there he goes. He's already in the hallway, headed towards the pre-op area. Now, give you an idea of what we're looking at here. This would be the family-facing visibility board that we would put in the waiting room, and each of these views would be published on a monitor at the nurse's station so they could get a top-down view of what's going on in the unit. So he's already in pre-op, and now he's on his way to the OR, and we should see him. There he is right in the OR, and he's going to enter into the OR with the nurse and the doctor, and they're going to start his procedure. So once his procedure starts, he's going to head over down to the med-surg area, and we can see as each one of these milestones is completed, we mark it complete so the family members know back in the waiting area where Richard is. So he's ready to start recovering. We're going to let him pause and take a break, and now we're going to pass it over to the pharmacy.
Hi, my name is Brooke. I'm with BD Pyxis, and while Richard is making his way from OR to the floor, I am down in pharmacy making sure that all of the orders we've received on our Pyxis equipment from Epic are either supplied up in the station or compounded per the physician order. First thing I'm going to do, because I see in my queue here a bag of vancomycin that I need to prepare, is use the Pyxis IV Prep solution in order to compound my drugs. It's using a series of image capture steps as well as gravimetrics to ensure accuracy of what I compound. When I'm done, I get my bag with an Epic barcode on it. This barcode is used both for BCMA as well as for my Pyxis Track and Deliver solution, which is a mobile handheld here. Before I leave pharmacy to deliver the medication, I'm going to use the handheld to scan that Epic barcode. It's going to communicate up to the nurse on the floor through the Epic integration that the drug is on its way. When I deliver it and I scan it at its delivery location, it will also tell the nurse at that point that it's been delivered. That way we save some calls back and forth between the floor and pharmacy.
Thank you. So my name is Steve. I'm with BD and I'm playing the role of the nurse today. So I've gone into the patient's room and I'm doing an assessment within Epic, see how the patient's doing, see what their kind of needs are for everything that's going on. They're going to pull up a list of the MAR, and inside the MAR they're able to use a link that goes to Pyxis MedLink that allows them to be able to queue up the medications at the med station so they don't have to wait in line. So he's going to go ahead and we're going to queue up the morphine for the PCA that we're going to get programmed. He's also going to queue up the vancomycin because now it's through the med track and deliver, we're able to see where it is within the system. So now I know that everything's been queued up and ready to go within the med station. So once I've left the patient's side, I'm going to go to the med room. Here in the med room, I'm going to pull up my list of patients. I'm going to log in using BioID. I'm going to get a list of my patients. I have Richard Hawkins here. Select all of his meds. These are all already been queued up because I did this during my assessment in the patient's room. I'm going to go ahead and remove my morphine syringe. It's going to pop out, open up the specific drawer that I need, and I just close it back up again. I'll also see with Richard Hawkins my vancomycin, and I know it's been delivered to this location using the track and deliver, keeping track of where the meds are. So I'm able to also get my vancomycin. So now I've gotten all the meds for my particular patient, Richard, and I'm going to go back to the patient room to start programming the meds. So I come back over here, I'm back into the patient's MAR and Epic. I want to start programming this med into the PCA syringe. So I go ahead and I scan the patient's wristband. It'll pull up all the meds. It'll tell me now to scan the medication, which in this case is going to be the PCA syringe. They'll scan that. And then the third thing we'll do is we'll scan the channel. And what that does is it tells Epic where to send the order through the IHE interface over to the Alaris system. Once it gets over here, Alaris will get the order come over. Takes a little bit because we're in a nice network here. It'll tell me install the PCA syringe. I'll install the PCA syringe. Once it gets in there, it'll recognize the type of syringe it is. I'll press that to confirm. And now the order will populate. So everything that's within the Epic MAR about how the order is going to be administered, it's going to be on there. The first part is the continuous piece. If I press next, this is now the patient component where they can administer their own doses as needed. Once I press confirm, it tells me to go ahead and close the door and lock it. Once I lock it, it has the entire order on the screen. I just have to press the start button to actually start infusing the drug. And once I do that, it'll start communicating back to Epic through that same IHE interface, all the different things that are going on with that particular order. So not only what's been administered as a continuous dose, but also what's been administered from the patient pushing the dose cord button to be able to get new doses. So, and I forgot a step, I'm sorry. So one of the things is if I didn't have the PCA syringe module, if I was trying to find that, I can now use the connection from Stanley to be able to identify where the syringe modules are.
So this is a mobile application called Mobile Locator. It's available on the iPad and iPhone. And you'll notice the fourth entry is the Alaris PCA pump. And this business status on it is in use. We pull that status directly off the pump. So when they started infusing medication, that status changed from available to in use. We also have a current updated location on the pump, so the nurse is able to find it quickly when they need the pump.
Okay, so now I've got the medication started. I walk away from the room, and in the process of walking away, then occlusion occurs. I'm going to hand it over to James with Spoke to show how the alarms get forwarded.
Thank you. Hi, I'm James Campbell from Spoke. At this point, I'm caring for another patient in another room when an occlusion alarm happens on the Alaris pump. With our integration to Alaris, I also receive that notification on my Spoke mobile application. At this point, I need to determine, I get the event from Alaris, and it tells me Mr. Hawkins is the patient, the room number, as well as the type of event, which is an occlusion, a downstream occlusion. From there, I'm going to make a decision to either complete the tasks that I'm working with this patient and go help Mr. Hawkins, or for my Spoke mobile application, I can actually escalate that to a charge nurse or a PCA, patient care assistant, that might be able to more quickly help Mr. Hawkins get that unoccluded. If I don't see this on my phone, there's also an automatic escalation. So after 2 minutes, that'll escalate to another caregiver to help Mr. Hawkins get unoccluded on his IV pump.
So now we've got our patient assessed, we've assessed the meds, we've taken care of any alarms. So now if I'm the charge nurse and I want to know what's going on within my floor, I have the ability to go in through the BD Health Site Viewer. It's a viewer that shows us all of the things that are going on patient related on the floor. So with the IV continuous infusion, it shows me all the infusions that are going on. If I want to get any more detail about any of the particular infusions on there, I just have to hover over, and it shows me the name of the drug, it shows me who it's on, what the current rate is, and in this case it even tells you that it's outside guardrails. So if I'm worried about compliance and whether the nurse is staying within the order, I'll get the information there. Also through my assessments, I can also see from a pharmacy standpoint all the errors that are coming up from the med stations, things like stockouts or a need to do a refill of a particular pocket because it's gotten too low or anything else like that. I can also come down here to the dose requests and be able to request a new dose. So if I know that there's a continuous order, and it hasn't yet populated on the screen, I can request that dose. It goes down to pharmacy, and then they can verify that that's a legitimate order and go ahead and process to get it filled. And this is a view that's available for both pharmacy and nursing, and it'll provide you all the information you need to keep track of the medications that are going on your floors. And that's the end of our clinical scenario. Thank you.